The government's health watchdog has warned an NHS trust in Worcestershire of a significant risk to patients as a result of its failure to report X-ray results to doctors.
The Worcestershire Acute Hospitals Trust, which runs 3 large hospitals and a number of community hospitals, is thought to have failed to report more than 10,000 sets of results. Callum Watkinson reports now from Redditch.
This goes back to an unannounced inspection by the Care Quality Commission last month of the Worcestershire Acute Hospitals Trust, which runs the Alexandra Hospital here in Redditch, the Worcester Royal and Kidderminster Hospital. Now, the results of that inspection have not been formally published, but they have been leaked to the media. And what they found, the Care Quality Commission, we understand, is that there is a backlog of up to 11,000 cases going as far back as at least January, cases in which X-rays have been carried out, but in which the results of those X-rays have not been given to the doctors and consultants who asked for those X-rays to be done and therefore have not been given to the patients concerned. Now, we understand that the Care Quality Commission has warned the Trust that the number of unreported images poses a potential significant risk to patients because it may have delayed treatment. Now, it's more bad news for this trust, which has a £50 million deficit and was placed in special measures last December by the Care Quality Commission amidst concerns over its A&E, paediatric, maternity and gynaecology services. Now, we have asked the trust to respond to this story. They sent a very brief statement which says, "We can confirm that we have received correspondence from CQC following an unannounced visit on the 27th of July 2016, and we are addressing their concerns and responding fully. Until we have done this," they say, "we will not be making any further comment." Now, the CQC itself has been similarly brief in its response. It's confirmed that it did carry out the inspection following, it said, information that had been received, and it added it will publish its findings in due course. But we do understand it has warned the trust that it could issue an enforcement notice over this situation, and that would effectively make it illegal for this trust to carry out scans and X-rays at any of its hospitals.
That's Callum Watkinson there reporting.